Breast cancer is the most common cancer among women worldwide. It happens when cells in the breast grow out of control, forming a tumor that can be life-threatening if not caught early. But the good news, early detection can mean 99% survival rate, but that means you must know the warning signs, and that is what we're here for today. What are the symptoms of breast cancer? The first one that we'll be looking at is a lump in the breast or your underarm. But what is a lump? A lump can be regarded as a solid mass of tissue that feels different from the rest of your breast. Not all lumps are cancerous. Some lumps are benign cysts, fibroadenomas, or blocked ducts. But any lump should be checked. Now, if you're going to be looking out for this lump, the first thing you should check out is how does it feel? How hard is it or firm? Is it irregular in shape? Does it move around easily when touched? Usually, lumps are usually painless, but not always. Lumps under the armpits may also signal that the cancer has spread to the lymph nodes, which is a part of the body's immune system. Now, lumps in cancer cases are known to be the most well-known type of symptoms. But here is the twist. Not all lumps are cancerous, and not all cancerous lumps are painful. Most breast cancer begin inside of the milk duct or lobules, and they can form a lump as they grow. If you feel a hard, irregular lump that doesn't move easily, especially if it's new, firm, and painless, then you should get it checked out immediately. Another symptom of breast cancer that we'll be looking at is changes in breast size and shape. Now, if you notice a sudden or progressive asymmetry in your breast that wasn't there before, such as one of your breasts appearing larger or swollen, or drooping lower than the other one, or misshapen or distorted, this can be caused by a growing tumor that could be altering the internal structure of the breast. Cancer can also cause fluid retention or inflammation, which makes the breast appear more swollen or tight. The third symptom of breast cancer can also be nipple discharge, especially bloody or clear fluid. When I talk about nipple discharge, I'm referring to unexpected fluid leaking out from the nipple, especially if it is bloody, clear, or greenish. Another symptom of breast cancer includes skin changes on the breast. This particular sign is very important to watch out for, especially if you notice dimpling or puckering, resembling an orange peel texture, and even redness, scaling, or flaking of the breast or nipple. You might also experience thickened skin in a localized area of your breast. Do not ignore the signs. These signs can point to inflammatory breast cancer, which is a rare but aggressive type of cancer where cancer cells block the skin's lymph vessels. This inflammation makes the breast appear red, swollen, and warm, often without a lump. Also, discharge can result from a tumor in the milk ducts, also known as the ductal carcinoma. While discharge can also be caused by hormonal imbalances or infection, bloody or persistent discharge is often a red flag. The fifth symptom of breast cancer can also include nipple retraction or inversion. In this case, the nipple turns inward and even becomes pulled into the breast. This is especially suspicious if it's a new change, that is something that you were not born with, or accompanied with pain or discharge. A tumor behind the nipple can pull on connective tissue, causing the nipple to retract. It's often a sign of central duct involvement or deeper structural changes that is happening within the breast. So if your nipple suddenly turns inward or looks different than usual, especially if it's just on one side, do not assume it is nothing. Cancer beneath the surface can pull on the tissue and cause this, and this kind of fluid can only come out from one part of the breast. It occurs without having to squeeze your breast. So any unexplained discharge from the nipple, particularly if it's bloody, milky, or clear, and you are sure that you're not breastfeeding, then that's a red flag. It might indicate cancer in the milk ducts. One symptom of breast cancer is swollen lymph nodes or collarbone, small hard lumps under the arm, near the breastbone, or even above the collarbone. Typically not painful but firm to touch. This may be the first sign that breast cancer has spread. If you notice enlarged, firm, or painless nodes, even without a visible breast lump, then that's a reason to seek medical help immediately. Also, lymph nodes filter harmful substances, including cancer cells. So if breast cancer spreads, it first goes to these nodes. Enlarged lymph nodes can be the first visible sign that can be felt even before a breast lump. Now, the last symptom of breast cancer that I'll be talking about is unexplained fatigue or weight loss. Constant tiredness even after rest, loss of appetite, weight loss without dieting, or increased activity. While not specific to breast cancer, chronic tiredness, sudden weight loss, or loss of appetite, combined with any of these signs that I have mentioned, could point to a more advanced stage of breast cancer. As cancer progresses, it can produce inflammatory chemicals and affect metabolism, leading to fatigue and muscle wasting. These are usually the late stage signs, but they are important to know as well. Lastly, itching or burning sensation in the nipple or breast. If you experience any of this, remember early detection is very critical. Stage 1 breast cancer has a 5-year survival rate of over 99%, but stage 4, when it spreads, it drops to around 29%. That is why it is critical to know you're normal, check yourself monthly, and report any changes early. If you notice any of these symptoms lasting more than 2 weeks, or if something just doesn't feel right, do not wait. It is always better to get it checked out as early as possible. Remember, early diagnosis can make all the difference. And one thing you should remember is that not all breast cancer starts with a lump. That is why monthly breast self-examinations, regular clinical checkups, and mammograms are very crucial. Now, have you done your self-examination this month? If not, I'll be posting a video tutorial on how to do it step by step, so make sure you're subscribed. If you found this video helpful, please give it a thumbs up, share it with someone you care about, and drop a comment below. Health is wealth if you made it this far. Let's spread awareness, save lives, and beat cancer together. Once again, I'm Vivian, and I'll see you in my next video. Bye.